Hey everyone, welcome to another 12 months of Black Pride virtual edition. My name is Kenya Hutton. I serve as a deputy director at the Center for Black Equity. And today, if you saw the announcements, we're going to be talking about surviving two pandemics, right? As a community, we've survived HIV, and we've survived. We're still here today to talk about surviving COVID-19. So we have two great individuals that's going to talk to us, and we're going to have just, as usual, just a general conversation, just to talk. If you're out there watching on Facebook, feel free to put in your comments and questions, and I'll pull them up on the screen, and our experts will, answer them for you. So for those of you that don't know, DC Black Pride is happening this year, first of all. We put out a press release, so we're going to do a little shameless plug. It is also International Black Pride Month, as proclaimed by Mayor Bowser of DC. I do want to let everyone know about one of our first events that we're going to have happening on May 23rd. We're going to have a comedy showcase. It's going to be streamed live on all these platforms, hosted by Anthony Oakes, and it's going to have the comedians Miss Chocolate, D-Lo, Nick Snow, Violet Gray are going to be part of this lineup. Thank you so much. Thank you again to our sponsors, Xfinity, Gilead, so forth and so on. You guys will get more information later. So without further ado, we're 2 minutes in, so I'm going to go and start introducing my folks. All right, so first I want to bring up Dr. Nii-Quartelai Quartey. He is the Multicultural Engagement Lead for COVID-19 Education Campaign at AARP, one of our sponsors. Welcome.
Thank you, Kenya. Nice to be here.
Awesome. How's everything? How's things been?
All things considered, things are well. Things are well. Feeling healthy. It's great to see some light at the end of the tunnel. Being that we've all been in this holding pattern, or what feels like a holding pattern for the past year during the pandemic. But we can't let up. We especially in our communities, we can't let up. Equity needs to be our North Star, and I'm really just excited to be here to do a look back and a look forward, placing the cause of equity related to this vaccine and in every ancillary part of the equation in terms of getting our communities over this hurdle that is better known as the COVID-19 pandemic.
Yes, awesome. Thank you so much. Thank you for that. All right, so the next person I want to bring up is someone that a lot of you out there know. He's been one of the champions for Black queer folks on the international front, ensuring that, as you said, equity. We all are experiencing a certain level of equity in the world, right? Just one of the things I always talk about is like being treated as a human like everybody else. The CEO and president of the Center for Black Equity, Mr. Earl Fowlkes. I'm sorry, Colonel Fowlkes.
Thank you. Don't forget I'm a Kentucky Colonel.
You are a Kentucky Colonel. How's things been?
It's been very well, thank you.
Awesome. So, you guys ready to dive in, start chatting about stuff?
Yes.
Yeah. All right. Typically I have questions prepared, but I really wanted this to be an organic discussion. Just to spend some time with you all, just to talk about it. So, surviving two pandemics. I'll start off. I think what I want to start off with is tell me, Nii-Quartelai, about some things that AARP is doing around COVID-19 and different communities.
I mean, I think that's a really great question, and I'm really proud of some of the work that we've been leading. The impact of COVID-19 on the Black community, and to the extent that there is data that is available, the LGBTQ community, has been staggering, revealing and exacerbating long-standing disparities in our health and in our economy. At AARP, we really believe that this is unacceptable. From our perspective, the disproportionate impact of the pandemic on older is a tragedy, considering that nearly 95% of COVID-19 deaths, they've been people age 50 and older. At around 40% of all deaths have been among nursing home residents and staff, with Black Hispanic nursing home residents dying at three times the rate of other residents. And what really hit me hard is this new CDC data that shows that the life expectancy in the United States has declined by a full year in the first half of 2020. It's the worst decline since World War II, and even more troubling than that, if you can imagine, the average life expectancy decreased by 2.7 years for non-Hispanic Black people, from 74.7 to 72 years old. Now that vaccine distribution is underway across the country, it's important that we push much harder to make sure that equity is a top priority. And that's part of the reason why we're always proud to partner with the Center for Black Equity, because you all really lead with equity, and you work to ensure that equity is front and center. Right now we're experiencing sort of a movement around diversity, equity, and inclusion. And I often say, I think the D&I part of it are concepts that are relatively easy to understand. They're relatively easy for people to hold. Now, the will to act on that is a whole other question, but D and I is relatively easy to understand. Equity for folks is a bit more challenging. It requires more of us. It requires a much deeper analysis of who's impacted and why they're impacted and how they're impacted. It's not a one-size-fits-all approach. And I think oftentimes, especially in the LGBTQ movement until recently, folks have used equity and equality synonymously. And I think this pandemic has proved that, yet again, those are really two different approaches, both important, both complementary, but they're not one and the same.
Right. Thank you for that. We're getting a little feedback, so I just want to make sure everyone is got their mics on. If you have headphones, plug it in. But thank you for that. There was a couple of things that you touched on, like the equity piece and the equity and equality piece. Like, people have been using those together interchangeably, and they're really not. Right? They're two different things. I was on a panel recently, and that was actually the topic of discussion. So I want to pivot over to Mr. Fowlkes. Thinking about, we're a couple of decades into the HIV epidemic, and now we have COVID. And in some circles, folks are talking about how it resembled how HIV affected communities back then. How COVID affected communities back then with HIV. Can you talk a little bit about some similarities between how, if there are, and if there aren't, tell me there aren't, but some similarities between how HIV affected communities and how COVID affected communities?
Well, HIV has been around for 40 years.
Right.
And that's 2 generations. And it has the same impact as COVID-19 is having on today's generation, is that it disproportionately impacts on the Black community. COVID-19 is the impact of the entire Black community. HIV disease really was targeted at gay men and gay and bisexual men, and some African American cisgender women. But the similarities were the federal government was slow to respond to HIV. It wasn't until President Reagan's good friend Rock Hudson, who was gay, became HIV positive and died of complications of HIV, that the government even mentioned the word. And Trump is the same situation. It was like, people were getting sick in China and in other parts of the world, and nothing was done. There was no preparing, there was no education, there was no acknowledgement that we have this serious disease that's taking place in another part of the global world that we live in. The other thing that's very similar is the blame game. The HIV came out, they were blaming on, they came from Africa, they were blaming on monkeys, they were blaming on, it was blaming on white gay men. There were, it was a blame game, as opposed to dealing with the disease and finding a way of taking care of people who are HIV positive and who are suffering from this disease. People spend more energy trying to, blame people, the down low brothers. Black women are getting affected because of down low behavior from black men. And the same thing in COVID-19. We blame it's a China disease. We blame it on Chinese people, blaming the Asians, as opposed to finding ways of taking care of people and getting people the message out of how to avoid COVID-19. I think some of our leaders were more interested in finding out who was to blame and who was the cause of it. And Asians, unfortunately, have been getting the brunt of a lot of these viruses. The Hong Kong flu, remember that? We don't know where these diseases come from oftentimes, but we should spend more time dealing with the impact of it as opposed to who caused it. We can do that in the back end.
Yeah. You touched on a few things. You drew a similarity between Reagan and Trump, which I thought was interesting. Because that was interesting. But also you talked about the blame game, right? That happened with HIV. And I saw hey, shout out to Alan Sharp. He said Haitians were also blamed. Back then, Asians were blamed. The LGBT community was to blame. Everyone was to blame, and now it's the Asian community to blame. What are some of what have been, and this is for either one of you, if you want to talk about some of the deep down long-term effects that come out of these blame games? Like, we see how, I'm not even going to get, I was about to answer my own question for you. But tell me about how the blame game really affected not only communities, but the success rate of these viruses.
Well, I'm going to start off with that. The blame game, if you spend time on the blame game, you're not spending time on finding solutions to the health crisis. More resources and more energy are been spent about whose fault it is, as opposed to of taking care of people who are in need. This is about taking care of people who are sick, taking care of people who are infected and affected, be it COVID-19 and or HIV disease. It also causes communities to rally behind the blame game, as opposed to dealing with the crisis within the community. So we were blaming everything on DL brothers because that's why black women were becoming positive. And of course, in that way, you're blaming DL brothers and you're basically blaming gay men. And you're demonizing gay men, and you're roasting them over the fire because of something that they allegedly did. And the same thing with COVID-19, when you're blaming, whether it came from China or not, that we have a disease and it's killing people. Right. And it's killing our people.
Right. Yeah, and I would just add to that. I mean, the blame game also leads to widening disparities. To Earl's point, when we're not, every minute that we spend not focused on the solution, developing solutions that touch more segments of our communities than not. Then that's more time for tragedy to strike. It's more time for health insecurity to set in, and so that's a serious cost. It's a serious cost to our communities. It's a serious cost to our families. It's a serious cost to our economy. And we've seen that there have been some pretty stark examples of the heavy cost of the blame game, with both pandemics. I would add that the blame game also sows seeds of distrust. And here we are today gathered on this platform of Facebook. I think you may also be streaming to YouTube. And most people are familiar, with some serious challenges that we've seen across the United States and around the world in terms of managing misinformation. And we've seen misinformation sort of spread at lightning speed, right? And it's a part of the reason why at AARP, we understood very early during this pandemic that the biggest value add that we could bring to our nation in crisis was to be that trusted source of information. We are fiercely nonpartisan, and we have the credibility to be able to provide information that folks can trust. And so, even now today, if anybody streaming goes to aarp.org/coronavirus, you can click on your state, and we have state-by-state guides, that are updated every single day with the most recent information from the CDC and from public health departments, among other officials, that offer you the information that you need in order to make your choice in terms of getting the vaccine and having access to that vaccine wherever it is that you live. And so I encourage people to check out that site. But
can you say the site one more time?
AARP.org/coronavirus. If you go to that page, it's a treasure trove of information. Oh, there it is on the crawl. Can you go? You can go there to get the information that you need, but managing, the potential for misinformation campaigns. When seeds of distrust are sown, that again, to Earl's point, it takes us away from being focused on solutions.
Yeah. And if I could add on to what Dr. Quartey was saying, and one of the reasons why it's so easy for the Center for Black Equity to partner with organizations such as AARP is because, unlike the HIV/AIDS disease pandemic, we didn't have very many sources of information, the trusted sources of information. We didn't have the internet like we have now. It was basically spread by word of mouth. And there were very few organizations who were willing to put out the correct information. And especially among older people who are more likely to distrust the newer forms of information dissemination, such as social media. And AARP has really picked up its game as far as covering the entire community, cisgender, heterosexual men and women, LGBTQ people. And that's very important because I think one of the major differences between now and 40 years ago and 30 years ago is that we have sources of good information that can be trusted. Now, people may choose not to, and they may want to rely on more less reliable sources, but we have some good sources out there that people can make informed decisions, and so they can not base it on the Tuskegee study. I don't want to take it because of the Tuskegee study and not knowing anything about the Tuskegee study, not knowing even where Tuskegee is or being able to spell it. They know something bad happened there. We have to be able to. Information is the key to getting equity in our community. That's one of the keys of getting equity.
I'm actually glad you brought that up. It's interesting because I was just on a panel yesterday. We were talking about COVID-19 and Tuskegee came up again. One of the things you talked about was how 30, 40 years ago, there was a lack of reliable information coming out of the community. Everyone, word of mouth was the way information was spread, right? And that caused a lot of division and misinformation and so forth. Now, here we are in 2020, 2021, during the COVID-19 pandemic. We saw that again, right? Where it was a lot of misinformation, things going on, but this was going on social media.
Right.
Right. What do you, and I think, and I'm going to just interject, one of the things I think that really led to a lot of, back then and now, the spread the stigma, the discrimination. I think that led to a lot of it. The only difference was last time it was word of mouth. This time was social media. What are ways that folks can, and I'm saying this because there's also still a lot of misinformation around HIV too, believe it or not.
Yes.
Like, you would think everyone has done the HIV 101.
We're not teaching anything. We're not teaching HIV prevention anymore.
Well, that's another panel discussion. Right. We can talk about that one for a while. Go ahead, Nii-Quartelai. You want to say something?
Yeah, I would just say, think before you post, think before you tweet, right? Consider the source.
Consider the source.
So often we're all moving so quick and fast, and we're quick to repost something or retweet something, that may resonate with us. But if we took that extra 2 to 3 seconds to consider the source before we did that, I think that's a simple way, a really simple rule of thumb that we can all apply, like literally a rule of thumb, that we can all apply, that can help us all do our part to manage misinformation. I mean, the more that we can do to not be a source of misinformation, the better. And so, I think that's one thing we can all do starting now.
Yeah.
And also look at when the dates of these articles could come out. I've seen people repost things that happened 5 years about someone, entertainer that happened 5 years ago. Like, did you not read the date? This is the whole news. You're just someone's reposting and you're reposting like it's new.
Yeah.
People, because we're in we've become an instant way of communications. Now everything is instant. Before you had to go to the library and look it up. Yeah.
It's almost like I had this discussion with someone else. It's about critical thinking has gone away, right? People don't really think no more before they hit repost or retweet. It's like, oh, this is great, and repost. And I have a family member that sends me the most craziest things, and I had to break down the other day and say, please do me a favor and spend 2 minutes and check the source, because all you have to do is Google it and you can find out that it's not true. I want to circle back around, since we're on the topic of mistrust and misinformation around HIV and COVID. I want to talk about something you said, Quarterly, around health insecurity, right? Can you talk a little bit more about health insecurity and how that has showed up in both of these health disparities?
Yeah. So, a number of folks that are streaming this might be familiar with a public health model that a lot of people apply. It's called social determinants of health. And it's this idea that, there are a number of variables, there are a number of factors that influence healthy people, healthy communities, right? Housing, transportation, public safety, access to healthcare, recreation. I mean, these are a number of things that influence how healthy you can be. And depending on what those factors look like in your community, they may influence how healthy you are, how healthy you can be. And so, I know that there are a number of partners that we're working with, that apply a social determinants of health model in order to address some of the things that make us that challenge our health security, our health and wellness, our ability to maintain health, and dare I say, our ability to achieve health and longevity. I mean, working at AARP for almost 5 years now, has really helped me to understand in no uncertain terms longevity as a justice issue. And I think that has been consistent when you look at the HIV pandemic and look at COVID, right? We can see those factors that consistently act as a drag on some of our abilities to be able to live long, healthy lives, quality lives, right?
Yeah.
And so, we have much work to do in isolating those factors. I mean, we all can't do it all. We've all got to do our part. But the movement builders that are doing housing justice work, and for folks that are leading, work on the workers' rights front, for people that are leading, work in terms of increasing access and affordability of healthcare, right? These are all factors that determine how healthy we can be. And there are also factors where we look at the disparity between white folks and black folks, between LGBTQ and non-LGBTQ folks. These disparities are stark. That has not changed, since the early days of HIV/AIDS, and neither should our resolve. Neither should our resolve to address them with everything we got. Starting with data, and this is the last point that I'll make on this. I often say, no data, no justice. No data, no justice. If we don't see Black people disaggregated in the data, if we can't see LGBTQ people disaggregated in the data, sometimes that compounds the challenge. I mean, it makes it hard for us to be able to understand, what we're really up against, and what winning these fights can look like over time.
The amazing thing about this whole discussion around health equity, the discussion is, people are having a discussion as though at one time we had health equity. We've never had health equity. We've always had food deserts. There were never. I never remember a Black neighborhood had a decent grocery store, supermarket. There was never good transportation in Black communities ever. There were never appropriate medical facilities. There was never a time when there was appropriate housing for everyone of different economic situations. We're talking about this. We've come from A and we've gone down to Z. We have never been to B. It's always been that way in our community. So we're addressing things that have been talked about, but it's never been actually looked at as resolving or contributing to the health equity of the longevity or lack of longevity of Black folks. This is something that's been part of our history since we've been in this country.
Yeah. Oh, true tea. I want to pop up a comment here from Ellen. As someone who has survived so far both pandemics, I'm struck by the difference between the response to the pandemic identified as primarily affecting gay bi men versus the response and resources galvanized, and also the sense of urgency for the pandemic that affected the entire population. Do any of you want to touch on that, talk about that?
Well, gay men, because the disease was painted as a white gay disease, and then Black, gay, and bisexual men started to become impacted by HIV disease. It was a whole thing that you're doing something bad. HIV, the difference between HIV and COVID-19 is the difference between good and bad. COVID-19, anyone can get it. A good Christian woman can get it. Your grandmother can get it. Good people get this disease. Therefore, it's different than HIV. HIV is a behavior thing. You have to do something to become HIV positive, and you have to engage in something that's not socially or health or accepted by our communities. Being gay is still taboo in the Black community, and that's a major difference. The difference is that people with HIV disease were sinning. People who died of COVID were innocent victims, and they were just struck down in the prime of their life, or they were just being good people, and they died. And neither one of them are correct. COVID-19 could have been arrested early on if people had done the right thing, if wore masks. If people weren't so willing, talked about wearing a mask, though you were limiting someone's freedom. There's nothing in the Constitution about freedom to wear a mask or not to wear a mask. It's a health concern, but people want to hold on to their individual rights. HIV could have been dealt differently if people hadn't applied so much judgment to the behavior of how you make it positive.
Dr. Quartey, you were going to say something?
I just want to zero in on, I think both pandemics have, they're examples of what a crisis in compassion can look like. And in the midst of this pandemic, we have seen social unrest due to racial discrimination. We've seen an uptick in, hate crimes directed to our Asian American Pacific Islander brothers, sisters, and siblings. And back to what Earl said at the beginning of this conversation, a lot of these things are the derivatives of the blame game. And so, starting with each of us doing our part, one of my mentors who has since gone on, he was HIV positive and was a civil rights leader with the NAACP, is on the national board, Willis Edwards. When I was a baby organizer in LA, undergrad at USC, one of the things that he taught folks like me and folks like Gina Clayton Johnson, do what you can from where you are with what you have. And that is an organizing principle that I have employed in my career and in my activism, and that I share with everybody that's streaming this here today. Because, let's be honest, when you look through your social media feed, or when you turn on the TV, you watch the news, or you read the news, every way you get your news, sometimes you can be overwhelmed. This past year has been overwhelming. It's been off the Richter scale in terms of being overwhelming. I think the social isolation, has challenged our health from the neck up and the neck down. And so, I think if folks don't walk away with anything else from this conversation, do what you can from where you are with what you have to address the crisis and compassion that we're seeing across our country. And let's do our very best to not make the same mistakes that we did with the HIV/AIDS pandemic. We have too much more information than we did back then.
Yeah.
We've seen that movie before. The sequel doesn't have to look the same as
that's something I would like to comment on, something that Dr. Quartey said. One of the major differences between now and the beginning of HIV is that HIV spawned a whole cadre of leaders and activists that never existed before. And many of the people who run organizations and run AIDS organizations and non-AIDS organizations, especially from like the Black Pride movement, many of the Black Pride movement leaders worked in HIV/AIDS. That was the first job, the first activism. And that has helped to preserve our community and help arrest the spread of HIV. It took a long time, but it's, we don't have as many people testing positive as before. Unfortunately, there's still too many people, and still too many young people testing positive. That's because of a lack of resources that have been drained away from fighting the pandemic. But the leadership that came out of HIV/AIDS leadership pool cannot be underestimated, because many of those people are still fighting the fight and fighting for social justice and housing justice and economic justice and health equity. Those people they got their teeth cut through HIV. I know to work doing HIV work, and many of my colleagues doing that. And that's something that's very important. It's sad that it had to take HIV to do it, but it did do it. It did bring up a rise of leadership.
Yeah.
Go ahead.
And it's important that we all consider how we're going to meet this moment. And as Earl mentions, sort of the generation of organizers and activists and professionals, that were moved to action in response to the HIV/AIDS pandemic. I have no doubt there's a whole generation of policy advocates, movement builders, content creators that will be moved by this pandemic. By, dare I say, the twin pandemics or triplet pandemics, depending on how you look at it. And so, that gives me hope that we're a part of something bigger that will respond to this thing over the course of many lifetimes. But let's not make the same mistakes that we did, before. Let's learn from one another. And again, that's part of the reason why I'm just so glad that AARP and the Center for Black Equity, that we have been working so closely together over the course of the past several years, to having these intergenerational conversations, and hopefully making a material difference in communities across the country at the same time.
And I think that's happening. I think this pandemic has spawned a whole bunch of different type of leaders. There's been a concern about isolation. People are stepping forth, talking about mental health and substance use, and actually forming organizations and forming support systems to end people's isolation. HIV was isolating in a different way. There was social isolation from the greater Black community, the greater community, but you could find, and even among your own peers, but people did stick together, and you could have friends, and there were support systems. And COVID-19, people were dying literally without having seen their families. You couldn't hold their hands, and at least when people with the HIV disease, you could actually help. A number of friends I've died in my arms. That didn't happen there. Right? The isolation and the grief is compounded by the economic impact and the lack of health resources, and the lack of resources. You're by yourself, and you're not working. How are you going to eat? How are you going to keep a roof over your head? How are you going to handle your abusive partner? And when you're forced to stay with a person who you don't like, or you don't have a place to stay. They're different, and there are people who are stepping forth and doing things in the community, in the Black gay community, men and women, and transgender women and men are stepping forth and are provide. They may not be as visible as it was during HIV, but HIV was almost invisible. You didn't know these things were happening unless you were involved in them.
Right.
Same thing's happening.
Same things happening, yeah. So if you're joining us, we are talking about surviving two pandemics, HIV and COVID-19, with Dr. Nii-Quartelai Quartey and Earl Fowlkes. I have one more comment from the audience, from Alan Sharp. Moving forward, thoughts on living with HIV/AIDS versus living with COVID, post-HIV meds, life and PrEP availability, and post-COVID-19 vaccination availability then. And then I promise I'll shut up. You don't have to shut up, Alan. Keep the comments coming.
No, Alan, we really appreciate your comments. And thank you for hanging with us and being a part of this conversation. I'm sure there's so many things you could be doing. And so thanks for spending time with us. I think, living, for folks that are living with HIV, for folks that are recovering from COVID. We haven't talked about the long haulers, people that contracted COVID, and they may not have COVID, but they still exhibit some of the symptoms of COVID, many months later, right? And so, these are folks that have experienced, cognitive disability. They're folks that have scarring of the lungs and a number of other sort of lingering health issues. So we have to be attentive to that. And we've got to be attentive to the fact that everybody doesn't have the same access to resources to mitigate, some of the challenges of, living with the effects of COVID, or living with HIV, right? And so access and affordability continue to be a major issue. Folks are going to see AARP continue to beat the drum on lowering the cost of prescription drugs. Whether you rely on insulin or whether you rely on antiretroviral medications, whether you rely on, whatever it is that you take to manage your condition, affordability and access are really important, especially as we get older. So I think that is a through line, and there were so many people during throughout the HIV pandemic that have and continue to fight to make sure that drugs are affordable. We fought to make sure that the COVID vaccine is free, and it should continue to be free, if not affordable for all.
Yeah.
Well, I think affordability is something that, having access, you can have affordability but not have access. I think a lot of people, especially in rural parts of our country and even some urban areas, but definitely in the South, don't have access to the myriad of HIV drugs, prevention drugs, and the drugs that maintain people's lives. We know that there are many people who've been HIV positive for 30, 40 plus years who are still living. So but they have access to good medical care. COVID-19, I have to say, we don't know. It's too new. We don't know we don't know what medicines are working. It's going to be like HIV in many ways, except for more accelerated because we're a lot better equipped to handle these kind of health crises than we were 40 years ago. But I think that we're going to be learning as we go along, and we don't know why people continue to test positive for COVID-19 even though they're not showing any symptoms. Who knows? We're still trying to wrestle with the strands of the virus coming from South Africa and Brazil. There are going to be other strands or variants that are going to come up over the next few years. We know more likely we're going to need a booster shot. What does that look like? And still, while we do, many people in this country have access to COVID-19 vaccine. We live in a different world. We live in a global world, a global economy. You see countries like India, you see countries like in Nigeria and Ghana and Brazil. These people don't have access to these wonderful medicines, and until they get the medicines, we're not going to be out of the doghouse on COVID-19 because people travel around the world and they immigrate and they migrate, they vacation, and so until we take care of everyone, no one is really safe from COVID-19.
Yeah.
And to your point, Earl, thank you for highlighting just the interconnectedness. And you highlighted that in no uncertain terms globally, but even in our communities. The essential grocery worker and the office manager are interconnected, right? I mean, there's a number of people that are trying to figure out, how do I safely go back into the office? Riding public transportation. Public transportation isn't just the essential grocery worker. The professionals in between. And so, it's important that we remain vigilant. I know we can all see some light at the end of the tunnel, but just remember that depending on your proximity to that light, you may be able to see more light than others. We shouldn't be. We should be proud of what we've been able to do in a very short period of time. I'm not a medical doctor, but I have a great appreciation for the scientists and medical doctors that developed this vaccine. I was just watching Dr. Kizzy Corbett, a 30-something-year-old Black woman, where the Moderna vaccine wouldn't be possible without her genius.
Yeah.
Wow. And to have come up with a vaccine that they've been working on for years, and to make that available to the masses as quickly as they did, I think we'll look back and see that piece of it is really a miracle.
Yeah.
Right.
alternative, would have us sort of stuck on Zoom still.
Yeah.
As opposed to being able to go outside and based on CDC guidance today, not necessarily having.
I saw that today too.
And I went to a baseball game last night, and for the first time in 2 years, and it felt weird. I was sitting out. It was still socially distanced, but people were sitting near me. But it was weird to be out watching in the open like it was 2 years ago.
Yeah. You just touched on something actually, which leads right to my next question about like going outside and feeling weird, right? I tell everybody that we're not going back to normal; we're going into a new normal, right? Because we're gonna be, the joke I said.
I have my mask.
The joke I said in the panel last night. I said, whereas, a year, 2 years ago, a social faux pas would be passing gas in public. Now it's coughing in public. Right, you cough in public, people are looking like
it's still a social faux pas.
It's still a faux pas, right? But now, like simple things like coughing, like it's a thing, and being around folks. But that's
allergy season,
right? But also, that's like messing, and correct me if I'm wrong, this is also messing with some of our mental health.
Oh yeah.
How we're going to interact with each other. When the CDC says, okay, everyone can go outside and have fun, our mental health has changed. So I want to talk to you all about some of the similarities of how mental health has affected, communities, with HIV and with COVID, and not just communities, because when I think of it, I say, as a Black person, we experience a level of mental health issues just living in this country, right? Being gay, being part of the LGBT community, that's another layer on top of what we already deal with, right? And then especially over the past year, with all the social unrest and Black trauma being broadcast all over television, that's another layer, right? So then now you got COVID on top of that. Like, what does it look like for us as a community, especially Black and brown folk, our mental health going forward when, on the tire top, you're saying, oh, great, go outside, be happy again. But what's our mental health going to look like going through HIV, COVID, and all the other things that we have to deal with as a community?
Well, we already know with some of the results. We have a much more domestic violence has increased, crime has increased, substance use has increased, overdose death has increased. People are tense. People are, any argument can lead to death. Road rage has increased. All these things have increased as a result that these are all symptoms of people not being able to cope. And until we're able to figure that out, and then we're going to need, and actually it's unfortunate that the more money didn't go to mental health services, because I think we're talking about ending the pandemic without talking about how to deal with the trauma that people have experienced.
Yes.
And that costs money.
Go ahead.
Yeah. And there's a lot in the American Rescue Plan. There are a lot of strategic investments. There's a lot of investments in families. There's a lot of investments for folks that are impoverished. I think the key is for us to lean into community. And I think this is something that the Center for Black Equity does very well. I've witnessed it time and time again. In fact, before the pandemic, one of my last trips on the road for AARP was in the state of Alabama, along with Earl, and we had a chance to meet the folks that are part of the TKO Society and a number of Black Pride leaders in places like Arkansas and Memphis, among others. And it was a reminder then, in the same way it's a reminder now, that community, can really be a major force in helping us to pull through turbulent times, challenging times like this. I know throughout the pandemic, AARP, set up a mutual aid site for folks in community to, just get to know other folks in their community. Giving our volunteers a chance to, phone our members so they could hear a friendly voice on the other end of that phone. And So to me, all of that underscores the importance, of community. That's not the only way we're going to get through this. And I'm not a medical doctor, and so I'm not giving any mental health advice, but I am a person who is anchored by the communities that I'm a part of. And I would be remiss if I didn't mention how the communities I'm a part of really help me to pull through this pandemic. It's helping me pull through this pandemic.
Yeah, love that. What we say, call that true tea. That's true tea, what you said. It is a community, and I love the fact that you actually wrote it down. That was my next angle, was community, how community can be effective. A lot of times we get stuck in give me, what can I get from these sources? But right in our own communities, we can be the resource we need to push on through. Mr. Fowlkes, I see you want to say something.
Well, the community is we always underestimate community because we don't always see it, and we don't turn on the 6 o'clock news and hear anything about what's going on in the Black LGBT community as far as dealing with COVID-19. I don't think I've seen many stories or heard of any articles written about us. We have a distinctive, vibrant, important, supportive community. Always have. That's how we survive. And if we didn't have community, most of us wouldn't survive. That call from someone who lives across country just to check on you, see how you're doing. Those things mean something, especially when you have nothing, you have no contact with any other human being. As so many of our people have been placed in situations where, the clubs are still important to a lot of Black gay folks. Clubs and bars, when those things close, those are community centers for a lot of people. For the party promoters who do party promotion in places like Little Rock and Memphis and Nashville, those people go out once a week. That's their community center. Many of them live in very isolated situations, or their family may not know they're even out. And that's how they deal with. That's their community center, as it was for me when I came out. The bars were the community center, and that's how I get my information. And which is not always correct information, but that's where the sources of information. Well, with so and so went to clinic and they said they A, B, and C, and of course by the time it got to me, it's the 5th time it's been retold, and it's totally wrong. But still, they gave me some information. And our community we need to acknowledge that we have a sense of community, and we have a loving community, a caring community. That it's not perfect, but no one's community is. But the fact that so many people are going to make it through this pandemic alive and in decent mental health, and it's going to be a new normal. I'm going to wear my mask probably for a long time, for a while. I'm certainly going to wear it on the plane for the rest of the time I travel. But the fact is, our people are still kicking and screaming, and it's coming out in the prides. We're not having a full Black Pride in DC. I know this is Kenya's thing, but the fact that people have been calling our office to find out what Black Prides are doing, because they want Black Prides have been a source of community building and relationship building and support systems and hand holding and all kinds of things that happen in communities. People didn't have that last year, and I have many conversations and many calls and emails from people who felt isolated and lonely because they weren't able to go to anybody's Black Pride. And we can't underestimate it. We tend to poo-poo stuff like that. Well, that's not really important. It is important. If you're isolated, you're living in a community where you don't have a lot of support, that's important.
Yes.
Yeah, and for so long, Black Prides, have been such a critical space for us as we, develop our identity and as we participate in community. And I just want to say, hats off to you, Earl, and Kenya, and all the affiliates of Center for Black Equity. This has been touch and go. You mentioned the masks, right? There's a scenario where in pockets of our communities where folks may not have received the vaccine for a whole variety of reasons, that maybe in a period of time, out of deference, maybe we do wear, the mask, even in places where maybe we don't have to. We're all interconnected, and we've all got to be vigilant. I'm just so glad we could gather today on this Zoom call to have a little chit chat. And I hope we've created some valuable insights for the folks in the stream.
Yes, thank you. And this is, people watch these things. Sometimes we do these things and we'll put it down. And then when I look at it like tomorrow, it's like 1,000 people watched it. So I'm sure this information is going to be valuable to a lot of folks. So I have one final question. And I want to preface this question that what your response is to go to two different groups of people, right? The response is going to go to those individuals like Alan, who said he survived 2 pandemics. Those where, even though they're born in the middle of HIV, it really wasn't their thing, but this is their first time. What are some parting words you want to give to these people so that they can see the light at the end of the tunnel after this is all over? What's some parting words for those two communities? Anybody can go first.
I defer to the good doctor.
Both of y'all. Nobody wants to go first.
I defer to Earl. Earl, go ahead.
I will say this. We were able, the Black queer community was able to survive HIV disease. We survived it. There are many people who were warriors who fell in the heat of battle, but we survived it. And my hat goes off to people like Alan, who still contribute, who did not give up, who maintained, who believed that his life had value and treated as such. Because the problem is, as a community, we're not taught to value our lives and our journey. And so what I would say is that those people who've gone on the COVID-19 journey have not, fortunately enough, to avoid the HIV disease journey. Your life has value, and it's important that you live and you respect the journey. Respect the journey, and know that your contributions to our community makes our community whole and better.
Respect the journey. Your life has value. I got to write that down. What about you, Dr. Quartey? Any parting words?
What comes to mind, I am a bit of a nerd when it comes to stuff, but self-confess. There's a book called The Fifth Discipline by Peter Senge, who's a very celebrated learning theorist, and when he talks about transformation, and I believe that we're living in a very transformative period for our country and for the world. When he talks about transformation, he says that transformation happens when we're willing to begin to re-examine some of our underlying assumptions. And so, I would offer to the folks that are streaming this is to think about what have been some of your underlying assumptions. Maybe at the beginning of the pandemic, perhaps throughout the pandemic. What have been some of those underlying assumptions that you have about yourself, that you have about our communities, that you have about our country, about the world around us? And hopefully folks are willing to re-examine some of those assumptions as we all do our part to build a new world, a more inclusive world, dare I say a radically more inclusive world, radically more inclusive communities, radically more inclusive solutions to the challenges, some of the most persistent challenges that we've seen from the early days of HIV/AIDS throughout this pandemic and beyond. Now is not the time for us to allow the blame game to occupy airwaves and occupy our email inboxes and just to consume us. Now is the time for us to co-create solutions. And as imperfect as some of those solutions may be, And all of that starts when we're willing to begin to re-examine some of our underlying assumptions.
Examine some of our underlying assumptions. Y'all like giving preaching a word. Alan, as someone residing smack in the middle of the target demographics for both of the organizations represented in tonight's panel and a beneficiary of both, I greatly appreciate the comments, information, and insights you've shared tonight, as well as this forum provided by Black Pride. Thank you, Alan, for hanging with us.
Alan. We appreciate you, Alan. We're Team Alan. We're the AARP member. Hey, Alan.
This has been a great conversation on surviving two pandemics. Once again, sitting with us this evening was Colonel Lord Earl Fowlkes and Dr. Nii-Quartelai Quartey. My name is Kenny Hutton. I serve as a Deputy Director at the Center for Black Equity. Let's not forget that to visit the website www.aarp.org/coronavirus for more information. And don't forget, on Sunday, May 23rd, we have a comedy show streaming live on all of our platforms, featuring Anthony Oakes, Miss Chocolate, D-Lo, Nick Snow, Violet Gray. Everyone watching tonight and everyone watching in the future, thank you very much. Thank you, gents. Stay safe.
I think what I'm interested in here, and every time you say that name, it just intrigues me.
Good night, everybody.